Good day, good day, good day. This is Dr. Shanae here. If it is morning, good morning, afternoon for you, or evening, listen, we're super excited to have our talk with our very own, my very own Camicia Evans. We are
Hey.
starting our series, the Collective Talks here at the Collective Wellness Institute. The idea is that we're going to support our community talking about health issues with people who understand those things. The nurses. I know y'all like doctors and everything, but the nurses really do the work. I know some amazing nurses, so I'm pulling on them and I'm asking them to join me for a quick conversation about things that we know y'all are dealing with. So, today's topic is spontaneous miscarriages. I know it just doesn't even have a like pretty name. It's not even it's a tough topic, but if
Mhm.
there's anybody who's capable of managing the topic with tact, expertise, compassion, it is Camicia Evans. So I want to give you an opportunity to hear from her who she is and what she does. Camicia, talk to the folks. Tell them who you are, what you do.
Hey, thank you, Dr. Shanae. I first want to just thank you for even putting this together and for it to be put on your heart um, to invite nurses to kind of engage in the conversation. So definitely appreciate that. I definitely think it is something that needs to be spoke about. Again, my name is Camicia Evans. A little bit about me. So I am a seasoned registered nurse, going on 13 years. Yeah, 13 years. Let's see. I feel that I am very passionate about um, healthcare. The some of these topics that we're discussing, especially here today, part of my background. Currently, I'm a clinical nurse manager for utilization review. Some people don't know what that is, but I basically, in the background, just a very quick, short way around that, work in behalf with the insurance companies, deciding if one, like people there, whether it's outpatient visits, hospital visits. My team is actually doing it, not me. Do clinical reviews to decide the appropriateness of care and the level of care, so that they can go ahead and pay it. But that's kind of what I currently do. What I previously did, and why I think that I'm a good choice for this, is I'm a previous labor and delivery nurse, 7 years experience. Labor and delivery was my first love. It still has a nice place in my heart. Like, that's where I started my nursing career from. And I've been blessed and privileged to be able to give compassionate care, seeing people bring life forth. However, unfortunately, there are times where it's not so happy of a place, and there's challenges that aren't always discussed that go along with that. And so I'm just excited to be a part of the Collective Wellness Institute's chats on today. So I'm looking forward to, kind of stepping in and diving deep on this challenging topic.
Awesome. Thank you. Wow. I can't believe it's been 13 years. I remember. I remember you in the nursing program. I
Wow.
definitely cannot believe it's been 13 years. That is, I can still see you in your white uniform go, going to class, getting ready to go to class. So,
Right. Does feel
but
like yesterday.
but what I can say is that I recognize that it's not easy to have that level of tenure in such a career, right? This is
Yeah.
a heavy, it's a heavy lift, and you so eloquently pointed out that it, in particularly labor and delivery, you get a chance to see life brought forward. And that brings a question to mind. I got to come back. I'm going to ask you about.
Okay.
Um, but but you also have had the unfortunate experience to journey along folks who did not successfully do that. And so I want to start with first just defining what is a spontaneous miscarriage? What is that?
Okay. So spontaneous miscarriage. So, of course, in order before we can get to a miscarriage, we have to have a confirmed pregnancy. So typically, someone will have missed their cycle, take a pregnancy test at home. Maybe they go and get it confirmed with the confirmed pregnancy with a blood test or like an ultrasound to say this person is indeed pregnant, right? So a spontaneous miscarriage would be the loss of that pregnancy prior to 20 weeks gestation. And it's considered prior to the age of what we consider viability. So a lot of these will take place usually before the first 12 weeks, but up to that 20 weeks of gestation, a loss of pregnancy within that first 20 weeks is what is a spontaneous support. Sorry, miscarriage, but I do just need to let you guys know in the health field, it is considered an abortion, spontaneous
That's what I
abortion.
was coming for. Like, so,
Okay.
because unfortunately, I have experienced that.
Mm-hmm.
My first son, spontaneously aborted. I was
Mm-hmm.
very offended by the term.
Mm-hmm.
So to hear that they are the same thing suggests to me that maybe the industry has recognized the need to change language public facing versus medical facing. Can you help me understand, like, is there a reason for two different terms?
Um, so technically, when there's it is in a sense a softer term to hear miscarried, like meaning like I didn't carry to full term. But technically, as a universal for within the labor, it's a standard term. It's either spontaneous or elective termination or abortion. So technically, in the medical field, that abortion, they use that one word, but they distinguish it by spontaneous or that it was elective.
So elective meaning that the person opted.
Yes.
Okay, I'm gonna come back to that too because
Okay.
I happened to have some conversations with nursing team, so I want to kind of come
Okay.
back to that. So just in sum, if you are pregnant and you
Yes.
are unsuccessful at progressing in your pregnancy past 20 weeks of gestation,
Yes.
that is called a spontaneous abortion and or for common sake, a
Hmm.
spontaneous miscarriage.
That's correct.
Got it. Um, for me, just a little disclosure, I was 19 weeks and hospitalized with the intent to see if I could progress to
Hmm.
21 weeks, um, and then decisions could have been made about viability. Now
Yeah.
shoot, that was 30 years ago.
Hmm.
So what I have seen since is that there have been, I think, more successful, I'm going to say, deliveries
Hmm.
um, over the years with the support of technological advances.
I would
Fair to
absolutely
say?
agree. I would
Okay.
agree with that, and
Okay.
especially at earlier age.
Okay.
So just as a sidebar, so when I was first starting nursing, so like I mentioned, labor and delivery was my first, which is, as a sidebar, a little bit, it was unheard of at the time that you went right from nursing school as a labor and delivery nurse. They want you to, get some outside experience. But anyhow, when I started labor and delivery, the age of viability was 23 weeks. And that was going to be a very premature, but I've been out the game a little bit. However, the age of viability has now come even less
Yes.
than that 23 weeks. But
Yes.
20 weeks is a very critical time just because it changes the narrative. There can still be a loss at greater than 20 weeks, but then the terms and things are kind of shifted.
Understood.
It doesn't make it any less painful. I'm not saying
No.
that a loss of a baby that is less than 20 weeks or greater than 20, that one is going to have less
Right.
emotional attachment to that. I'm just stating that there is a difference as to kind of like they'll, like for instance, you mentioned 19 weeks. So at 19 weeks, yeah, the medical team will try to help preserve that pregnancy as long as possible and to kind of get you there. And it's something called what they call expected management, meaning that I'm going to kind of do things to kind of prevent whatever I can, but your hands are kind of tied as to what you can do
Mm-hmm.
versus, the closer the baby gets to actually being able to live and survive outside of the womb.
The more efforts that will go forward.
That is correct.
Yeah, I could say that I distinctly remember. I distinctly remember. So at 19 weeks, right before the loss of our son, we had we had a sonogram.
Mm-hmm.
We heard heartbeat. We did all the things that were common with prenatal care.
Right.
And so, he had a name,
Yeah.
and we were anticipating. So it was very, very real to us, and that is why the term was offensive. I
Yeah.
get it, I get it. Now I was 19, 19 years old, and I was completely unfazed, but that's a different topic. And so, um, but what I distinctly remember was there came a point in time when they stopped monitoring his heartbeat.
Yeah.
And that was unfortunate for me. I think they were trying to spare me, but they couldn't convince, because that was done. No one could convince me that his life ended in utero.
Understood.
You get what I'm saying? And
Yeah.
what I mean by that is and I don't know if I'm using the right language, but I had to deliver. So I was induced, and I had to like
Yeah.
deliver
Yeah.
my son. And so because the choices that were made included not monitoring his heartbeat, there was this kind of question
Mm-hmm.
about whether or not that his life, you know, ended in the passage, right? In the
Gotcha.
passage of the
Mm-hmm.
birthing process, as opposed to because I had no, what do you call it, sac in the water. My water broke. I had no
Yeah.
more, what is it, amniotic fluid?
Yes.
I
Mm-hmm.
don't know, but
Okay.
and so I'm sharing that with detail, because what I'm hearing you say is that the gestation, the stage of gestation impacts what the medical team can and will do.
Mm-hmm.
And so if someone's experience is different than mine, or someone, that we could all have very different experiences, although we had several people could have lost a child before preterm, right?
Right. Mm-hmm.
Um, and to understand that is because it could feel like y'all mishandling me, right? Like if
Yeah.
you don't understand medically what is appropriate, it can feel like the medical team is
Is
not
in
handling you well. So I want to
yeah.
be fair about that.
Okay. I want to address, there's so many things to unpack on what you said. First of all, I know that you said almost 30 years, but my heart still goes out to you for your loss, and sometimes I think people just kind of disregard it as if, that was a part of you, right?
Mhm,
And
mhm.
so I'm just gonna be who I am, and God is in the midst of that. And so,
Yes,
um, just to kind of tag on it, and I know you have a son then after, which would be considered your rainbow baby. I
yes.
don't know if you've ever heard of that term, but a
Mhm.
rainbow baby, the world has taken rainbow for something different, but rainbow is a promise of God. And so he becomes your promise.
Yes.
So I'm just glad that God, smiled on you for that. But what I will say, to kind of go back to your experience, as to, you made a very valid point as to like the heart rate, and you don't know for sure if it was in utero or through the actual delivery. So, and then also the other thing that I want to kind of bring up is, it seems like a lack of sensitivity as far as even, kind of advocating or explaining some of the process. So many people who have never been through something like that don't realize that it's actually a delivery, even if it's a live baby or not. So it's not something to take lightly. You literally have to go through everything, the body changing and all of that, just as somebody who gets to take their baby home. So,
Mhm.
um, so like I said, the times have definitely changed, even within the last 7 years, where they used. Remember, I said that viability used to be considered 23 weeks, where they would do like all kinds of measures to try to sustain
Mhm.
that baby, and even then, the chances were slim, but there still was a good
Yes.
chance. So even prior to that, like if it was less than 20 weeks, they'd be like, there's nothing we can do. And and they would basically kind of, especially if your water broke, there's some things that become added risk. It becomes at a risk that, of course, the loss of the baby, it becomes a risk for infection from mom. It becomes a risk for a lot of different things that can happen.
Mhm.
Before, because I remember being early in L&D where some of that narrative started to change, how we dealt with somebody whose water broke at 19 weeks, and then or 20 weeks, and then seeing the progression as to how they started to do things different. This is going to seem really insensitive. I can recall, I know, one of the experiences that I had as a labor nurse, and the sad thing is just like, the baby still had a heartbeat. Mom's water broke. I think she was like 16, 17 weeks maybe. And the hospital at the time said there's really nothing we could do. They're like, she's like, I want to keep my baby. There were some doctors who was trying to advocate that she should go ahead and that they can medically. So there's that medically induced termination, right?
Mhm.
And so they were trying to advocate for her to go ahead and terminate her pregnancy, because the chances of baby surviving, less than that 23 weeks was slim. The waters broke, all kinds of nerves. So they're counseling her to terminate. And she was adamant in her faith. No, I'm going to hold on to I'm going to remain pregnant. So they say, this is what we're going to do. We don't have a medical reason to keep you here in the hospital, but she was on bed rest. Like they sent her home at 16, 17 weeks on bed rest. And, basically kind of gave her some instructions as to like complete, absolute, strict bed rest,
Mhm.
reasons why she would need to come back. She did. She was able to, her pregnancy was able to be maintained. It didn't, I mean, she wasn't able to go to full term, but her baby, I think when she came back to the hospital, I think she was 21, 22 weeks. At the point, she still was on bed rest, but now she's under medical care. And I
Yes.
think the baby delivered between 27, 28 weeks. So what I was saying, wanted to point out is when you said that you were not sure if that heart rate, if the baby died in the womb, or not. It's very possible just because your water breaks at 19 weeks or sooner before that 20 weeks, that pregnancy can still
Mhm.
be maintained. There's just risks that have to be monitored.
Absolutely.
I just want to just as an added note as to not to justify why they didn't, because typically to kind of say that that is a fetal loss, it's usually because it's a confirmed no heart rate.
Right.
Um, I don't know, especially times have definitely changed as to even
Hmm.
the monitoring it. So the standard would be that you need to confirm. And so for someone who is less than 20 weeks, it's very hard to kind of monitor continuously
Yeah.
that fetal heart rate. So a lot of times the nurses will do spot checks, and the fetal heart rate is definitely different than what you and I heart rate would be as an adult.
Right.
Normal heart rate for an adult would be 60 to 100,
Hmm.
where fetal heart rate is going to be over 120.
Right.
120 to 160 is like a very strong, good, viable heart rate. As a heart rate starts going below 60, that the chances of that baby kind of maintaining that is it's not good.
Yeah.
So I don't know the reason as to why they didn't confirm before they kind of put you through the process of delivery, other than to say that technology has changed.
Yeah.
At the end of the day, it doesn't make it any difference. You do need medical team who are going to advocate for the whole person,
Yeah.
mind, body, and spirit.
Yeah.
So
I
that's
appreciate that. I really do. I'm grateful to have been able to navigate that process. It is a reality that we faced,
mhm,
but it doesn't hold the wounds it used to hold. I've
right.
um, definitely been able to kind of work through that, reconcile that. We have memorabilia, and
Yeah.
our children are aware of him, and his presence is in the house.
Hmm.
In terms of the things that were associated with that time, I don't hold any. I don't hold the hospital responsible in any way either. I was in a Catholic hospital. I
Hmm.
believe that they would have done whatever they thought they could have done within reason. I remember them distinctly um warning me about the risks to my own health. Again, I'm 19-year-old.
Sorry, you went out a little bit.
Oh, no, I don't hold the hospital. I don't have any
I don't know if
challenges
I'm
with the
freezing or if
hospital.
you're freezing. I can't hear you though.
Oh, no. I think it'll come back. I hear you
Yeah.
just fine.
Okay, I hear you again.
So, yeah, so I think the hospital did all that they thought they could do to preserve all life.
Right.
It was very clear that my life was elevated in
Hmm.
terms of priority, and
Hmm.
I'm not upset about that. I mean, the situation is not easy for anyone, but with that being said, the times have changed. Believe it or not, I have a stepbrother who was born at 21 weeks. And
Wow.
yeah, he's fiery. So, he does have some challenges, and um I understand, what comes along with premature birth as well. I was blessed to have my rainbow child, and he is a jewel. At
Yes.
25, he'll be 26 this year. He's getting married this year. So,
Congratulations.
yes, we have been blessed. We were able to reconcile God's providence and sovereignty in that situation, and find purpose in it. And our family grew tremendously immediately after that. Um,
Right.
so anyway, this not being about us, but I think it's important to share, it is possible to move past a really painful experience like that. Um, Kamisha is absolutely correct. I had to do everything that, and again, 30 years ago, I do believe there have been advances, but I did have to do everything that a normal delivery mom who had delivered would have done, inclusive of it. This is where I had a hard time,
Uh-oh.
inclusive of being on the same
Yes.
floor with the crying babies and rolled out in the wheelchair at the last day of my discharge as if I had a child in my arm. And again, I was unsaved. So I really just wanted to cuss all those people out for not letting me get up and walk out, discreetly.
Yeah.
This was also the time, in this time in um, our medical world, a normal hospital stay was 3 days.
Hmm.
After a baby was delivered was 3 days. I think my
Right.
stay was shortened. I do think my stay was shortened. But it was all the things came, all the delivery
Yeah.
things came with that. So what I would like to ask next is, are there risk factors? That's such a challenging thing. So, are there risk factors that people can or should pay attention to?
There's absolutely risk factors to somebody more at risk for spontaneous
Yes.
miscarriage. Yeah, there are. So first of all, um, I want to say that even with all of the advances of medicine and the advances with technology, it's still not 100%. It's not one cause, or like, it can pinpointed. So let me give you a couple of things. I'm trying to look over at my notes too, but there are a couple of things. The primary thing that really you can't do anything about this is a lot of miscarriages happen within that first 20 weeks, but really within the first trimester, chromosomal genetic. There's a lot of chromosomal things that made that pregnancy may not be at all compatible with life. Um, no, that's kind of like tough to say, but
Hmm.
I just throw in my plug here that I do believe in the whole person, mind, body, spirit. Now, Dr. Shanae knows me very well. When we talking about the mind, that is not my specialty at all. But when we talking about the body and the spirit, I can get with you. The
Hmm.
mind, I'm going to direct you directly to her. But as far as that, I do think science, physically within the body, there are chromosomal things. Some of that I believe is spiritual as to why God just kind of blocks that even before it gets there. Outside of that, some other risk factors. Someone who has reproductive abnormal ad abnormalities. Okay, I can't even get it out. Such as their uterus, maybe it's not the it's something called like a bicornate uterus. It's like kind of like a heart shape. Your uterus is what we call gynecoid, more oval shaped. And so sometimes that uterus is kind of like split in half. So instead of having like one, it's like having two uteruses within one. That times, I'm not saying that someone who gets pregnant can't deliver with a bicornate uterus, but it does make that implantation of that embryo more difficult. Okay, so those are some of the physiological things. There's infection. So when somebody who like STDs really especially, but there's some other infections that aren't just STDs, but STDs especially put you at a higher risk. Someone who's trauma. So like say somebody was less than 20 weeks in a car accident, they're definitely in a way higher risk. But when we start talking about trauma, to be realistic, there's other challenges, physical abuse, things like that are risk. Someone who already has like chronic health problems, high blood pressure, diabetes, different things as far as inflammation are also at risk. Increased maternal age. So like I said, with spontaneous miscarriage, it's not just, you can be young and have a miscarriage, but you can be old as well. However, a risk factor is the older that you are, more likely to have a miscarriage. A higher percentage is if you will, is what I should say. Um, let's see. I think those are some of the real common ones. Oh, one really big one, substance abuse. That includes even cigarette smoking. Cigarette smoking is a huge one, especially when you're talking nicotine that constricts your blood vessels and your, you know, your blood flow. So you're narrowing down these vessels, and it's kind of, you know, make it hard for blood flow, oxygen to sustain life for that uterus. So those are some of like the big factors, but more so, are you asking like signs that somebody may be having a miscarriage, or more so, what are some of the risk factors related to it?
Well, no, you answered. Definitely gonna get to that next as
Oh,
well. You were breaking up a little bit, but I'll recant what I heard.
okay.
There could be some chromosomal abnormalities. There could be some conditions, uterus conditions that can become an issue. Trauma, um, abuse, substances, and maternal age. Did I miss something? Infection.
Infection. Mhm.
Infection.
Yes. And
Yes.
so I mentioned sexually transmitted is a huge one, but like somebody who may have like kittens or cats, right? There's an infection called toxoplasm. I might be missaying it. I'm sorry. Toxoplasmosis, right?
Hmm.
And it's from consuming raw meats that may be infected with it, or even handling kitty litter from a
Hmm.
cat that is infected
Hmm.
can increase that risk. So that's something that's non-sexual, but like herpes is a
Yeah.
huge one that it's not the only one, but it's a huge one. Um, Fibroids, I didn't mention that, but that would be like kind of like some of the physical abnormality. I cannot say that word today. I'm sorry.
Abnormality. It's all right.
I'm struggling saying that word. Fibroids, PID, the pelvic inflammatory disease, a huge one. Someone who's had multiple surgeries. So maybe they had fibroids that were removed surgically. Maybe they had multiple abortions prior, like abortions, meaning elective abortions, where they've had the procedure to get that done. It causes scar tissue and then makes it harder when it's actually time and wanted. So,
Good point. So that opens a question for me. There's
okay.
another term that I've heard, and I probably need to do a whole nother talk about this, but there's
Mm-hmm.
another term that I've heard, incompetent cervix.
Mm-hmm.
The medical field is not nice to women at all. It really is not nice to women. Even when you were talking about maternal age, they call women who get to a certain age geriatric. It's so
35.
disrespectful.
35. You would think that, you know, I'm just in my prime at that age. How am I considered a senior citizen in the maternity world? They're not nice. It's actually, it becomes bad because someone who is 35 and pregnant is called advanced maternal age.
It's terrible. That's a whole different conversation. But
Yeah.
are there connections between incompetent cervix and early spontaneous miscarriages?
Yes. So a lot of times with the incompetent cervix, basically that cervix, you end up going into preterm labor. And so that's one of the other things that I didn't get to mention when you were speaking of your story when you delivered. That's one of the other factors is that if that your cervix is the opening for the uterus that the baby is delivered from. And so if that cervix is starting to dilate, it becomes difficult to maintain that, because basically your body is almost kind of expelling or causing you to be pushed into delivery. And so, of course, a fetus that is, 15 weeks, 17 weeks, and your cervix is opening to already 8, 9, 10 centimeters is what you need to be able to deliver. And so if you're starting to open 3, 4, 5 centimeters, it's going to be difficult for you to maintain that pregnancy. When you get to, if you are get to closer to that 25 weeks or so, they do have something called a cerclage, which is a stitch that they would kind of help, it's not nothing. When your body wants to be in labor, your body, nobody can stop that. That's God in your body.
Mm-hmm.
But there are procedures that, like, such as a cerclage, that they would try to help to maintain it, trying to maintain that pregnancy as long as possible. But an incompetent cervix is definitely a huge one, especially someone who has had a history of preterm and delivers early. Like, they're at a very high risk that it will continue, because their body just opens up. So,
Yes.
an incompetent cervix, it is definitely a real thing,
Mm-hmm.
and it does definitely make you at higher risk for a spontaneous miscarriage.
Thank you for that. I definitely received that diagnosis. Again, like, really, y'all, just treat me any old kind of way. But I did have the cerclage with both of my children, and I did see the proactive efforts from the medical team for both of my children, who were born healthy, full term. One we had to induce because she didn't want to come. No, she's a difficult one.
On her own terms.
And
On her own terms.
on time, she just would not come. Like, what is happening? But so yes, it is absolutely a term that I've, again, 30, 30 plus 25 plus years ago, those terms, we just weren't having these kinds of conversations. So
Right.
you tell a 20-year-old, a 22-year-old who's always just assumed she was going to be able to be a mama, you know, those things just they don't register. And that's why we're doing this, right? We're having this conversation to normalize complications, right? Like,
Yes.
complications are more common than they have been discussed. Now,
Yes.
I was challenged with the word normalize, because I don't want to suggest that it's normal to have a complication, but I
Correct.
want to create a space of safety for people to recognize you're not a foreign alien on the side of the corner of the world,
Yes.
the only person experiencing complications or having difficulties in this area. And on the other side of that, that the because medical, still has an opportunity to grow and change and mature itself, that those
Yes.
individuals are not just being harsh and offensive. Like, this is kind of we're still learning the woman's body, if we really talk about the medical industry in the United States.
Right.
The women have only recently been studied. So that's a completely different conversation. But the purpose for having this talk, and the reason why I share as openly as I do, is because I want people to recognize, like, if you've found yourself anywhere on the spectrum of losing a child before before full term birth, like, you're not alone. There are compassionate medical providers who are out there to support
Yeah.
you. There have been technological advances. I mean, now we have doulas. I didn't even know what that was back then, or even if they existed. And there we have a whole specialization in the counseling field for what is
Yes.
called maternal mental health, and that is the
Yes.
mental health associated with women who are navigating life as a mother, or trying to navigate life as a mother.
Right.
And it spans pregnancy, infertility, and
Right.
pregnancy loss, right? So we are coming together to wrap our arms around women who have found themselves in unpleasant situations in an area that they've been
Mhm.
socialized to be in. Women have been so socialized to that they're supposed to be moms, that it is
Right.
unconsciously causes them to feel damaged,
Mhm.
and some people are even challenging seeing their worth and reconciling, their spiritual relationships, when this part of their life doesn't seem to flow as naturally as we try to socialize women. So
Right.
that's my soapbox about that. I don't want to get off too far. I don't want to hold you too far. But you did mention a moment ago that there might be some signs that we could understand that might be associated with a spontaneous miscarriage.
Yes. Okay. So, well, first of all, once the pregnancy is confirmed, typically you're not having a cycle anymore. Your body is going to need that kind of like that uterine lining is thickening, that is basically becoming the placenta, is becoming what is nourishing that baby, that growing baby, right? So some of the signs, pelvic cramping, like that is nonstop, and like it would be now. I I want to say as a disclaimer, okay, all cramping is not necessarily you're just having a miscarriage. Especially at the early stages as a baby is growing, you may feel some discomfort. There may, especially your body, there's so many things that's going on. Hormonal changes, changes in, your fluid levels, and changes in your shape and your looks, and just a whole myriad of things that are changing. But if you start noticing cramping, that is not going away, that, no matter what you do, is increasing worse, or abdominal pain, sharp pains, that's not normal. Bleeding. Some people will, um, they may even, like, as far as the rupture of membranes, you feel like, you're leaking fluid, especially when pain is with these things. Clots, those things are not normal. You do need to seek medical attention. And I want to just add it at this point, this disclaimer. I'm glad that you asked me this question, and just as an overall broad, there seems to be sometimes because people suffer in silence, they don't think that, maybe their concerns aren't being heard or addressed. You guys are your own best advocate, meaning that there are times where people will kind of dismiss, and your body. And so just know that if you are pregnant, cramping, um, pelvic pain, bleeding, those are not normal, especially in early phases of carrying that pregnancy. Now, when you get closer to the end and it's closer to deliver, we expect that you're going to have cramping. And so some of the same signs that someone would be experiencing as, like, when they're actually full term and actually time to go into labor, are some of the same ones that they will experience earlier on. It's just that they're way too early for it. And so I just wanted to kind of put that out there, just because I do believe that there is a disparity within healthcare, especially in pregnancy, and especially with minorities. It is a disparity. A lot of times, the problem is that, it's we've developed a culture where people don't seek out help. even therapy. They don't seek out, I'm having a problem, things are going wrong, and I don't speak up. And then when they do speak up, they're not being heard because it just seems like, it's being brushed off. So I just think there needs to be more awareness around that as well.
Thank you. That is consistent with what we talk about with our clients. We regularly remind our clients that they have a right to advocate for themselves. They have a right to a quality relationship with their healthcare provider. They have a right to feel heard and respected and responded to. And they have a right to change if they don't feel like they're getting that kind of support from a healthcare provider.
Yes.
Unfortunately, like therapists, healthcare providers have been going nonstop at
Hmm.
incredible rates since the pandemic, right? Or even before the pandemic. I mean, in Florida, the burnout for nurses has been extensive for years, years. I don't
Hmm.
even have the updated stats, but when I was first studying compassion fatigue, the numbers were egregious. So I can only imagine what they are
Right.
now. And while that helps us to understand that an unpleasant exchange could be an extension of that burnout or compassion fatigue, it is not an excuse. So when we
No.
talk with our clients about that, we do it to to clarify that it is possible that it's not personal, but because it's happening
Hmm.
to them personally, they have a right to make a change.
Correct.
If nothing other than having an honest conversation, which is what I usually recommend first, to give the healthcare provider an opportunity to recalibrate and to apologize, or what
Right.
believers would say, repent, change their behavior, change their
Yes.
mind, and not just glaze over sorry, but make adjustments because they really do intend on caring for the patient and doing so in a quality manner. However, we know that that doesn't guarantee that the fruit of that conversation will be desirable. And
Mhm.
we recommend that people do what's best for their health and wellness. And one of the best ways you can communicate your dissatisfaction is by disconnecting, right? I'm gonna go find me another provider. I went as far as to give a review. I forget the name of the medical health grade. I went as far as to share on someone's health grade
Right.
why I was not coming back, because I found her to be incredibly offensive. And sometimes you have to be that loud so that the
Yeah.
industry doesn't go to the wayside. But with that being said, I appreciate that information, those signs, the pelvic pain, the bleeding, the cramping, the things that are commonly associated with closer
I
pre.
need to add one more.
Go ahead.
I'm so sorry. This is
No, you're fine.
extremely important though, because my mind was going to lesser of an age, but especially the higher that you are, you're going to start feeling your baby move.
Yes.
And if you are not feeling your baby move, and like say you go sit down, you go eat something, you kind of move that baby around, and that baby is not active and moving, you do need to go seek medical help. Like and it's, I just want to just add this added thing. I appreciate you saying about the healthcare grade. I think also it's a challenge with people. They may say something is hurting. They may say, I don't feel right, but then they're very vague about it.
Yes.
I can tell you that sometimes like stomach pain in general, it's hard to identify that. And I hear this, I ain't been at the bedside going on 6 years. something like that. I think about 6 years I haven't been at the bedside. However, I still have people coming to me just in general, like, oh, my stomach hurts, this, that, and the other. I'm just going to tell you guys, as a nurse, if you're coming with that kind of, and especially to get my attention, if you're like, oh, I don't know, I just don't feel good that you spoke up about it, but you got to be more specific.
Yes.
Like, you know your body more than anybody else. So descriptors such as, is it sharp pain? Is it just like a constant pain, a pressure? Is it the worst pain that you've ever felt in your life? Can you tell where it is? I'm not saying that you guys have to be medical professionals, but just get better at communicating what you're feeling. And so when something is different, that you can explain that it's different. If you're used to feeling your baby move and your baby's very active, and today this baby ain't really moved much at all, like, you need to be able to speak up and say something like that. So I sorry, just one last
No, that's
disclaimer.
good.
You mentioned about, like, if you don't like the professional, the health grade and all that, yes, I agree, but I have to also give a caution, especially when you're dealing with maternity, because the later you wait to speak and make your grievances known, the harder it will be for you to then transfer care.
Gotcha. That's
Especially
good.
with maternity, you become a greater risk. So
That's good.
the thing is, it's really important to establish a trusting relationship with someone you're comfortable with from the beginning.
Yeah.
And in the beginning, if you notice that, this person just seems to be blowing me off, like I'm just another number to them, they're not like even really trying to get to know me. How do I trust them when something is serious going on, that they're going to even respond? So it's really important.
Oh no, I think we lost her. Uh, so while she reconnects, I will say, um, that was really good. It was really, really good that you want to act early and not wait till the last minute because of the challenge in transferring care. I'm going to give her a chance to reconnect. That is really valuable information. No, you're fine. You're fine. Having a trusted medical provider, medical team is important. So in essence, what I'm hearing is preventatively, you know, building your trusting relationship before you even become pregnant, and knowing that you
Yeah.
feel comfortable with your healthcare provider. I know I love my GY, and I'm not having no more babies, so she won't be my OB. But
Right.
but I love her, and before I moved
It's still
here,
important to
I,
develop.
I develop
It's
develop
just
a
still important no
relationship
matter who your
early.
provider is.
Yes,
Yes.
yes, develop that relationship early. And if you all are clients of the Collective Wellness Institute, we are not shy about sharing who the providers are that we trust, the providers that we refer to, and the providers that refer to us. We are not shy about that. And if you have really amazing providers, we ask you to share them with us as well, because if we keep sending our folks to the same providers, they're going to run out of capacity. So we support that idea that you should develop your trusting team beforehand, and that's not just OB or GYN. I mean, that's, if you have other health conditions, it's your PCP. There are other providers who may actually prove to be very supportive and necessary on your treatment team if you become pregnant. For instance, if you have diabetes and you become pregnant, you probably want your OB and your practitioner
Endocrinologist.
to, there you go, endocrinologist to work together. So with that being said, like I said, I don't want to
Shoot.
hold, oh, I lost her. I don't want to hold Camicia too long. I'm trusting that this was fruitful for you all. We have some additional topics that are coming We welcome your questions. You can email your questions to info@communityvictory.com. In the subject, just write Collective Talks questions, and we will respond to you. So, with that being said, I'm super thrilled that we had this time to talk. We pressed through technology, it happens, but we keep going, forward. I'm not sure if I lost her completely, but I'm sure I can get her back again. And so this has been enlightening. I hope that you found this content helpful. And the more I think about this, I will be bringing her back because I have some additional questions that are related to just maternal care. So yeah, y'all have a great one. Send us some love through the comments, follow, like, and all that good stuff. And we will be back with another episode of Collective Talks.